right, well, I would love to welcome Dr. Marie Morse. She is a board-certified adult neurologist with special qualifications in child neurology and board-certified fellowship trained in sleep medicine specialist. She is the director of child neurology and pediatric sleep medicine at Janice Weiss Children's Hospital, Geisinger Health Systems. Dr. Morse is internationally recognized as a key opinion leader in sleep medicine, especially with regards to central disorders of hypersomnolence, such as narcolepsy and idiopathic hypersomnia. She has proudly embraced her reputation as a healthcare disruptor, challenging the current delivery of care, embracing digital transformation, and advocating for new treatments and delivery of care that is through partnership with the patient and community, personalizing their wellness journey to their individual needs. And as a result, Dr. Morse is highly regarded advisor for multiple advocacy organizations, biomedical companies, and well-established industry partners. Her commitment to effective change, as well as engaging and activating individuals in their own care journey, is illustrated by the success seen in her programmatic development of novel, asynchronous, integrated, personalized sleep health programs. Sleep to Be Well and Wake Up and Learn represent first ever novel sleep command centers that provide virtually delivered sleep education, screening and intervention that reaches individuals across the clinical setting and within the community. And it would be amiss not to comment on her commitment as a scientific advisory board member and champion for Sleep Consortium endorsing the bold innovative approach to putting patients as the drivers to innovation and discovery. She's also been regularly involved with the Hypersomnia Foundation and deeply committed to our mission and our community. So over to you, Dr. Morse. Thank you.
Thank you so much, Claire. I really appreciate it. We're going to have a nice conversation about brain fog. And I think that this is a really important topic because this is something that really we're starting to get a little bit more of one awareness around it, but also our arms around what does it actually look like. So this presentation is entitled Thinking Clearly Again, Beating Brain Fog for a Brighter Day. And I entitled it in this way because I want to kick things off and close this presentation today with hope, because very frequently I encounter individuals who are living with narcolepsy, who are living with idiopathic hypersomnia, who really feel as though they have missed the opportunity to live their life and are struggling to not only navigate the symptoms that occur with it, but also the cognitive symptoms that they may experience related to brain fog. So today, what are we going to talk about? We're first and foremost going to say what brain fog is. We're then going to talk about how it impacts us when we're experiencing it. What are any approaches to potentially treat brain fog? How do you discuss the symptoms and with who? And then how can we achieve clearer days ahead? So first and foremost, brain fog defined. Oh no, what happened? Oh, I hate when I'm about to do something and my computer crashes.
I thought that was part of your presentation and you were just gonna it was a joke.
No, it is what people experience on a daily basis. It is feeling like a joke when you are experiencing that on a day-to-day basis. What you're attempting to do feels like it defaults to being an error in your life. It feels like your brain is on constant reboot. I use those illustrations, yes, of course, to relay, just as Claire had stated. I thought that was a joke. I thought that this is something that really you weren't experiencing with your PowerPoint. This is kind of similar to when people try to explain to others what it is that they feel like they're experiencing. And many times are met with the idea of, is that a joke? I just told you this. Why is it that you're taking so long? So one of the things that is important is saying that this is a symptom that there is not even a specific definition for. Last year, we published a paper where we were giving a proposed definition to try to be more specific to the symptoms that are being experienced in hypersomnia disorders. And the reason why we wanted to be specific to this is because you will see in the next few slides that brain fog is a pervasive disorder. It's a pervasive symptomatology that actually is terminology that came from the patient population. This is not a term that came from the medical world and was applied to patients. It is words that have been chosen by patients to convey experiences that they're having that the medical world has actually adopted as a constellation of symptoms. And you'll see that these are symptoms that very frequently have been described in other conditions outside of conditions like idiopathic hypersomnia and narcolepsy. However, there may be unique factors in hypersomnia and hypersomnolence disorders that may make it distinct. And so our definition is stating that brain fog in hypersomnia disorders be defined as a cognitive dysfunction that may or may not be linked with excessive sleepiness related to an underlying neuronal dysfunction which reduces concentration and impairs information processing, leading to a complaint of lack of clarity, of mental thinking and awareness. And so this is important to know that as we continue to look at this, the question becomes, how is this related to sleepiness? And you're going to see that in the data that we have available, it does appear to be independent of the sleepiness, but influenced by the presence of the sleepiness. So it's not doing any favors to the experience of having brain fog. When you think about how brain fog is experienced, this word cloud actually gives a really great visual depiction of what people describe on a regular basis. And it even also will describe other areas that we may see overlapping. And so you see other conditions here that also have described this fuzzy headed, forgetfulness, mental fog, my head is in the clouds. And you see things like infection and dementia, autoimmune disease, fibromyalgia. You also see a very common theme of different diets that have been used and implemented, such as ketogenic diet and paleo diet. You also see that this isn't something that potentially is static because you see things like flare up that may also be contributing to how people are experiencing these symptoms. So there have been structured evaluations of how people are describing it. And so what is beautiful about today's day and age is the fact that social media has become a beautiful place for not only creating social networks of support, but also from a scientific perspective, an area of discovery where the patient's voice is elevated and the lived experience is illustrated in a way that can better be understood and allow for us to potentially get better handle on what this looks like. So there was a study that had looked at brain fog on Reddit and had reviewed over 1,500 posts, so 1,663 posts. This particular evaluation actually did not include conditions like idiopathic hypersomnia or narcolepsy. It was more inclined to include things like um, uh, fibromyalgia, COVID-19, and interestingly, even sexually related brain fog symptoms, most specifically things related to withholding from either sexual interaction or masturbation, which for me was something that I learned as a brand new thing that could potentially elicit a symptom of brain fog. What they found is that there was heterogeneous experiences, which included a feeling of dissociation, almost like an out of body experience. Fatigue, meaning that it felt like it took me more effort to do things, and that even despite that effort, I wasn't able to do them as well. Forgetfulness, as well as excessive cognitive effort. It was associated with a wide range of illnesses. There also was some reports of patients who were either using certain medications or withdrawing from medications that described brain fog. And there was a whole host of behaviors. When you're looking at this kind of Venn diagram of what we're seeing, you can see that there is the descriptions that perhaps if you're a person who is living with IH or narcolepsy and is experiencing brain fog, you may be saying these mirror things that I experience regularly. Things like emotional numbness or anhedonia, meaning that it's really hard for me to elicit an emotional response to things that normally should make a person feel happy or scared or sad or angry. I just really could care less. Fatigue, groggy, dizzy, headache. So even a physical pain experience being associated with it, as well as a feeling of instability. excessive cognitive efforts and struggle, difficulty communicating, word finding problems, stuttering, forgetfulness, poor concentration, distractibility, inattentive lapses. And then again, these dissociated experiences, depersonalization, and derealization. Some of the challenges when you look at this Venn diagram or this bubble mapping of the symptoms that are experienced is that these also could fall into a variety of other categories that would miss the boat of being able to encapsulate them as an experience of brain fog. What I mean by that is that you may put these kinds of areas in a neurocognitive function. You'd put this potentially over with a different medical discipline or problem. And then you may experience some of these being packaged into psychiatric manifestations. Overall, these are all representing features that are likely consistent with, as mentioned in our proposed definition, a neuronal dysfunction, a brain based challenge. Now, when we zero in on individuals living with hypersomnolence, there was a similar strategy that we had applied. So, in working with Trend Community, we had looked at two online sleep disorder communities, both including individuals with narcolepsy as well as individuals with idiopathic hypersomnia. There were over 355,000 posts and comments, and a natural language processing was applied to these conversations to recognize and characterize themes. There were 5,384 brain fog related posts between 2011 and 2023. This is an important time frame to be able to look at. Why? Because many perceive that brain fog was a new term that was introduced associated with the COVID-19 phenomena. However, what you will see is that brain fog pre-existed COVID-19 and even was on the rise before COVID-19 started. There were two main things that were done. One was an odds ratio, which was calculated, which was saying what is the likelihood that certain things were related to conversations of brain fog versus other conversations. So, what is the odds of that happening? And then there was applied topic modeling, which is a process which reveals common themes in community discussions. And so what you're seeing here is that we're applying the ability of taking everything that is being shared and elevating the patient voice through social media, what patients and caregivers are sharing, and what facilitated discussions are doing. There then is this analytics that's applied, and then it really is helping us to have unmet needs being discovered and really generating a comprehensive review of the patient voice. So is it a growing problem or is it really just a growing discussion? And so what you're seeing here, as mentioned, is that you are seeing a growing proportion of the comments and posts that were occurring increasing well before 2020. And so if we were to say that 2020 was when COVID-19 occurred, and if that could potentially have been where this had manifested, we would have been wrong. We see that we had peaks and valleys, but then a more sustained growth from 2014 forward. With that stated, we find that the more that we are seeing brain fog mentioned over time, the more that we also are seeing different thematics of how it may actually be described or what terms may be being used. So brain fog by far is the most commonly used term. However, some people may just refer to it as fog or having a fogginess. Others may refer to it as a mental fog. And then there may be a variety, in a minority of conversations, a variety of other terms that are utilized. On a recent webinar that was done with some international colleagues, I was surprised to learn a very different trend than what we see in the United States. I had shared with you earlier that brain fog is a term that was brought to the medical community by people living with experience and symptoms. Internationally, such as with my colleagues in France, they had shared that this was a term that they adopted from the US as clinicians because they observed that these were the symptoms that were growing in the US and started asking their patients about it. And their patients didn't have a word to put with the symptom spectrum that was being described. And so it's an interesting way of being able to put numbers and understanding and why things like social media and using communities to understand the lived experience is so important. Because if we rely on medicine and we rely on science to kickstart everything that's going to help solve for a better way of living, we will fail every single time. in order to achieve the goals for every single person, we need to start listening to the communities who are impacted. So when you're pulling it together, as mentioned, brain fog existed before 2019, but we saw a substantial increase also occurred before 2020. It has similarity to other disorders, being significantly associated with memory and attention difficulties. However, what is distinct about brain fog and hypersomnolence disorders is it's also associated with sleep-related concepts, and this may be unique to hypersomnolence disorders. So when you're seeing this little map over here, it's giving you an illustration of the association of when brain fog was being described and what other things were in association with it. And so this isn't giving you a context of positive or negative, but just potentially where brain fog may be getting impacted or where brain fog may impact other areas. And so you see a combination of things. Again, diet really coming to the forefront of something that is a common theme, but you see memory issues. You also see ADHD or attentional type issues. You then also see areas where it could potentially impact the performance, such as workplace and accommodations and school and accommodations. You also may see a variety of different medications, which may have either a positive or negative impact. And we'll dig a little bit more into that. When looking at treatment, there is unfortunately no medications that have been developed or studied specifically with the intention to get an indication to manage brain fog. However, drugs that target the cluster of symptoms compromising or comprising brain fog or the potential pathophysiology could have beneficial effects. The biggest challenge we have is that if we don't have a definition, how do we create the right cohort of individuals who fulfill the symptom structure to get a better understanding of the pathophysiology? It also is lacking a target of what does good look like? How do we prove that there's improvement in brain fog? Is it a performance on a neurocognitive battery? Is it a performance on what you're able to do in daily life or activities of daily living? Now, with that stated, for central disorders of hypersomnolence, because we see that sleep-related symptoms and sleepiness may modify what the experience of brain fog may be, there may be some improvement related to it. It may also just be a proxy of symptoms of brain fog. So in a survey of people with idiopathic hypersomnia, there was a reported current use of amphetamine, dextroamphetamine in about a third, methylphenidate in 21.8, modafinil, armodafinil 38%, melatonin in 12%, flumazenil 5%, clarithromycin in 5%, or a form of oxybate in about 3%. And some were taking more than one medication. So the reason why you're seeing greater than 100% is because some may have been taking some in combination. Now, despite having treatment, brain fog symptoms persisted in about 50%, 26.3%, and 54.3% of people with NT1, NT2, and IH, despite treatments. So EDS treatments may reduce brain fog for some patients with sleep disorders, but not all, and not necessarily complete resolution of symptoms. The reason I make this illustration is because of the fact that it's important to know when we're using medications, what is it that we're hoping to see benefit in? This is where we need to understand what is this lived experience we're having and what is the measure of benefit. Because if I am disregarding what you're describing as brain fog and just packaging it as EDS, I'm going to fail every time trying to only use EDS medications. And if I am recognizing that, yes, there's EDS and yes, there is brain fog, seeing whether or not by modifying EDS, do I see any improvement in brain fog? And whatever is residual, what else can I do to add on and potentially improve? Now, there's one medication that is indicated for the treatment of idiopathic hypersomnia. So low sodium or mixed salt oxybate is the only medication that currently has an FDA approval for the treatment of idiopathic hypersomnia, where we do see brain fog be very prevalent. Now, the reason I bring this up specifically is not just to highlight an FDA-approved medication, but to highlight a specific component of the clinical trial that may be relevant to this topic. So what was done was a phase 3 double-blind randomized withdrawal study of low sodium oxybate or mixed salt oxybate, which led to the approval for this medication for idiopathic hypersomnia. One of the endpoints evaluated was the idiopathic hypersomnia severity scale. And that's what you're seeing over to the right, is that these are some questions that are asked. So there's 14 questions that are asked. And for each of them, there are multiple choices that are kind of giving you an understanding of how the person is performing in that particular area. Overall, there was a significant improvement in the symptomatology, in the symptoms related. So when you're looking at the idiopathic hypersomnia severity scale, it's a scale between 0 and 50. Greater than 22 is considered consistent with idiopathic hypersomnia, and escalating scores are resulting in a greater or representing a greater or more severe degree of idiopathic hypersomnia. And so their responses significantly improved in totality. However, there's one particular question that may be relevant to brain fog. And so, although not a direct assessment of brain fog, please do not mistake me for saying that this measures brain fog, but it may approximate some of the symptoms of being experienced with brain fog. And that question is, do you consider that your hypersomnolence is a problem in terms of your proper intellectual function? Problems with concentrating, memory problems, decrease in your intellectual performance. And so you can see where there would be a perception that that could be an approximation. Participants who were taking low sodium oxybate or mixed salt oxybate had improved IHSS scores overall, but they also had improvement in this area, with some individuals even saying that they achieved a normalization of that experience. And so that becomes important because idiopathic this medication is indicated for idiopathic hypersomnia without any of the restrictions of saying only for sleepiness or only for sleep inertia. And so may introduce an opportunity where oxybates can potentially be beneficial for some individuals for a variety of reasons that may not be considered the traditional reasons for benefit, such as the excessive daytime sleepiness, long sleep times, or sleep inertia. However, when thinking about brain fog, it would be completely incorrect to say that we're only going to think about using medicines to treat the symptoms of brain fog. Brain fog invade every single part of your life. And so having a better understanding of what your starting point is and what your goals are only going to help you to be able to create a full treatment paradigm that is going to get you to a better level of functioning. So it starts with having the right players involved to understand who you are and where you're at. Neuropsychology can play a role by providing a neurocognitive assessment to identify are there specific neurocognitive domains that may require specific attention or rehab services, something for you to be able to follow over time. Do you find that it's more of an intentional issue, a processing issue, a word finding issue? These are different domains that may require different strategies to allow for you to optimize the full degree of functioning. Physical medicine and rehab, including their affiliated services, physical therapy, occupational therapy, speech therapy assessments. These individuals, especially your occupational therapists, can also do school work and driving evaluations and accommodation considerations, everything from ergonomics to potentially strategies that may allow you to function at a higher level despite your struggles with brain fog. Considering psychology and psychotherapy, when there's comorbid conditions, that can also further augment. So if there is comorbid depression, anxiety, obsessive compulsive disorder, that is going to make it harder for you to potentially get through the symptoms of brain fog, or even potentially express which is falling into what. If those things don't exist, you don't have those types of medical conditions, there is the risk of you having an adjustment disorder with depressed mood or anxious mood. What does that mean? It's not depression as a diagnosis or anxiety of a diagnosis. It's me trying to adjust to the fact that my life has been stolen away from me. And therefore, being able to introduce coping strategies that prevent you from going that downward spiral of feeling limited by the fact that you're living with a condition that is challenging you to live most optimally. We can't neglect that a person isn't living life alone. They have families or they may have a significant other. And so psychology and psychotherapy can also offer family or couples counseling, perhaps introducing the ability to have a level playing field to talk about the things that may seem unrealistic to someone else in your close sphere as to not being able to do or struggling with. It also is important to consider other medical disciplines, a complementary management of other existing medical disorders, or perhaps a surveillance for medical disorders you're at risk for. And this is only going to augment your ability to navigate brain fog, even though it seems completely disconnected. If I have postural orthostatic tachycardia syndrome that is completely out of control, it is also going to rob me of opportunities to be able to put into strategies to optimize my neurocognitive function and really navigate brain fog. If I have diabetes and my glucose is out of control, that is only going to worsen my perception or my experience of navigating brain fog. So, really making sure that we're looking at these pieces. Furthering that point, the medications that are utilized for other disciplines, whether it's psychiatry or other medical disciplines, may help or hurt the experience of brain fog. You may experience that perhaps a medication used for migraine or a medication used for blood pressure is making it more difficult for you to navigate the symptoms of brain fog than you were previously. By ensuring that you're having all of these team members playing on the same playing ground, it makes it more likely for you to navigate successfully. When you're being challenged by brain fog and then tasked to try and characterize and then put into categories each of these things and how they interact, it really is not a winning recipe at all. And as you had seen in the brain cloud or the word cloud demonstrated by a brain, nutrition and exercise physiology are ones that we don't want to disregard. It is not uncommon for individuals to describe that there are certain foods that may help or hurt their experience. Although this is an area of exploration that continues to need further understanding, we recognize diet considerations such as things like variations on a ketogenic diet are medically helpful in a variety of conditions, especially things like epilepsy, where although when we prescribe them, we're prescribing it for seizure control, there is clear literature that demonstrates improvements in behavior, cognition, and even sleep. And so disregarding these as things as potential opportunities to improve really are ones that I would say would be silly of us to disregard. However, any diet or exercise consideration that we may pursue should always be done under the guidance of a physician to ensure that it's safe for you and also that you're not risking any micronutrients that may actually result in worsening the symptoms that you're experiencing. Last, but definitely not least, what else makes you feel good? One of my favorite quotes is from Carl Sagan, where he states that the absence of evidence is not the evidence of absence. If there is something that you participate in, that you experience improvement in your lived daily function and a reduction of your brain fog, that is something, whether it's placebo or not, for you to hold on to. I always say that is with caution of, is there risk, financial risk or physical risk or otherwise, then obviously we need to take that balance. But if it's something like massage therapy really makes me feel like I can function better, the absence of evidence is not the evidence of absence. And so therefore, we want to take a handle on anything that we're able to utilize to really help us navigate in the right direction. So many times people struggle with, should I tell people or what do I tell people? How do you share your story and shape your struggles? There's always a saying where say things like, it takes a village to raise a child. Well, it doesn't take a village just to raise a child. It takes a village for most people to live successfully. If you look at something like Maslow's hierarchy of needs, belongingness is actually one of those needs. And so being able to feel secure with a group of other individuals who you can share in what you're experiencing, either with individuals who have the same shared experience or those you're sharing your life with because they're family or their loved ones or their colleagues, becomes really important, because when we feel as though that we are marginalized or alienated, it's only going to make it harder for us to reach from when we're feeling down. So with home and family, it is important to develop comfort describing your experience with not only IH, but brain fog and the challenges you may have. And this may differ for family, friends, and work. So what you may share with family and friends might be more intimate. It might be things like, I struggle with brain fog, and that greatly limits my ability to shower or prepare my own food, or I feel unsafe cooking my own food. Where at work, it may be along the lines of I struggle with symptoms that impact my cognitive, my ability to sustain cognitive function. And so, therefore, I'm benefited potentially by having shorter bouts of work where I'm able to take breaks and I'm able to go back to it. These are the timelines that I work best at, and these are things I'm doing. And I would appreciate feedback on where you see that there may be opportunities or where I may be struggling and not recognizing it. It's important to identify tasks where you may be able to do it alone or need help. Asking for help is not a sign of weakness. Asking for accommodations isn't a sign for weakness. It's a sign of you seeking success. And it is important to know that even if you don't need those supports, having them as a safety net is not a bad thing either. Every day can give you a different delivery. And so having something that can back you up becomes really good. And as I shared, don't limit yourself by the disbelief of someone else. If your family doesn't believe your symptoms, don't let that define your mental or physical wellness. You can always invite family to attend doctor's appointments for additional educational information. You can also direct them to websites like the Hypersomnia Foundation for them to have their own learning on their own time. With academics and employment, there are accommodations that can be helpful for you to be more successful. And with both of these, the Hypersomnia Foundation has some great resources for you to be able to review. There also are technologies that can be helpful. The Assistive Technology Act is intended to promote people's awareness of and access to assistive technologies, devices, and services. And it really is trying to help people who have disabilities so they can fully participate in education, employment, and activities of daily living. And this covers disabilities of all ages, all disabilities in all environments. These are some illustrations of if you were to look at whether it's Apple or Microsoft resources, that there are a variety of different things that can be utilized for you that may help you. So, for instance, Safari Reader, it has less distractions, more attractions, so allows for you to have more of a focus. Guided access, being able to break things down to doing them one thing at a time. If you have difficulty with reading spoken content, listen along as you read or write. You can see similar types of things over here using things like Copilot that can really help you with being able to navigate and even provide those reminders when you're struggling to be able to get through the day to day. So, what I would say to you is clear the path ahead by knowing where you are and where you are coming from. When trying to achieve a goal of saying, I just want to be normal, my normal is not the same as Claire's normal. And in fact, my normal 5 years ago isn't the same as my normal today. And so, really understanding who you are, where you're at, and where you want to go, and where you have been, it allows for you to celebrate your successes and recognize when you're on the right path. Utilizing things like a symptom diary to help in tracking what your symptoms are and things that modify it and how you're able to communicate it will be really important. You can track what the symptoms and when they're occurring and what the severity associated disability may be. It also can give you understanding of how your sleep may be related or medication and what it has an influence on. You can use something more broad like this in order to be able to kind of record those. And this would be an example. And this is an example of someone who had narcolepsy. And you see that they're able to put words to the things that they're experiencing. And so they say, I have excessive daytime sleepiness, headache, I'm doing things and not remembering. So automatic behavior, cataplexy, feeling dizzy, faint, increased heart rate, brain fog, restless, broken sleep, sleep paralysis. And you see they illustrate it across the day of how these things manifested and what the impact was. And you see that they describe it as annoying, frustrating, feeling stupid. And that is now giving you the words to put to a discussion to have with your provider. You're able to give an illustration of what it looks like across the day, as well as what the consequence of it was and what the emotional content related. It also may give you a pattern to be able to see, is that occurring alone or was there overlap with the excessive daytime sleepiness or the headache or other things that may be occurring, like the quality of your sleep the night before. So my goal for you is I can see clearly now that the rain is gone. And this is where you cue the music, you start singing everyone together. I'm just kidding. I'm not going to make anyone sing unless you want to. But the goal for a day like today is for us to start really digging into what are these symptoms, what is the lived experience and consequence, give you some insights of that. There are starting to be some foundational structures that still need a lot to fill in. But this is going to allow us to start moving forward to understand where we can go and really have those brighter days ahead. Thank you.
Thank you so much, Dr. Morse. And I would love to hear you sing, actually.
No, you don't.
Oh my gosh, I can't help you there. I've got a terrible voice. Thank you for that. It's very illuminating and really important, I think.